Misconceptions about the menstrual period. From Memorial Basilieviller Hospital, Department of Obstetrics and Gynecology. Opus. Dr. Amina Baran spoke out about the well-known misconceptions about the menstrual period. Interval. It is defined by the public as a physiological event that has many names such as menstruation and menstruation. Experienced by young girls entering puberty and every woman of childbearing age once a month. Most women who do not have any health problems go through this process every month until menopause. Every day, new information is obtained about this special experience in a woman's life. But some misinformation spread by word of mouth in society can lead to a decrease in a woman's quality of life. The entire menstrual cycle in women is designed for pregnancy. Every month, the inner lining of the uterus is nourished and thickened by blood vessels under the influence of hormones. And at the same time an egg begins to grow in the ovary area. If the developing egg is not fertilized by a sperm, the egg that has completed its development will be replaced by the new egg. In the process, the tissue developing in the inner lining of the uterus is expelled from the female body as menstrual blood. This natural process causes many physiological and psychological changes in the female body. However, there is a lot of misinformation circulating in the community about these changes. 1. Even if there is pain during menstruation, painkillers should not be taken as this prevents the dirty blood from dripping out. If you have severe pain during menstruation, and if you do not suffer from any other systemic diseases, then there is no problem with taking analgesics. Although the amount of menstrual bleeding may decrease with the use of painkillers, this is not a problem. As it is believed, dirty blood does not accumulate inside. 2. Women who live together coincide with their menstrual periods. Every woman's menstrual cycle varies. Some women suffer from PCOS and delayed menstruation. Some women have hormonal problems and frequent periods. Others have irregular periods. The menstrual period of women who live in the same house is not affected by each other. 3. After marriage, menstrual pain disappears. Period pain does not go away after marriage. Only at pregnancy and childbirth does the menstrual pain called primary dysmenorrhea, which is not a health problem, stop. 4. Using tampons is unhygienic because it blocks the flow of contaminated blood. The use of tampons is safe for women who do not want to use pads. For example, on the contrary, tampons should be used for those who are allergic to pads. However, it is important to change tampons at least every 6 hours. 5. Bathing during menstruation cuts off the blood. It is unhealthy because it blocks the flow of contaminated blood. You can shower during menstruation. The only condition is to take a standing shower. Sitting in the bathtub is not appropriate. 6. You can't get pregnant during your period. Since some women experience irregular periods, menstruation may be confused. It is possible to get pregnant during intercourse during the period of intermittent bleeding. 7. Period delaying drugs are harmful. Menstrual delay medications are not harmful. It can be used safely during holiday periods or special days. 8. During my period, my body expels harmful toxins and is cleansed. The blood flow during menstruation is completely shaped by changing hormones. In other words, they are membrane cells inside the uterus. It does not contain toxic and dirty substances.